Trying to get everything to...
Oh! Whew. Oh my God. Padre Santo, qué rico.
Yeah.
Wow. Ay, gracias, qué bueno que vine. Wow.
What's going through your mind after doing those 2 adjustments now?
I feel like I even want to cry.
Yeah, it's okay. I mean...
I want to cry.
Yeah, it's okay. But yeah, it's an emotional thing, right?
Oh, yes. I feel like a new person already.
That's good. Yeah. You know, it's scared like you too. Like, what would you tell them?
Don't be scared. Just go.
All right, Adriana. So I know we already talked about it earlier, but kind of walk me through again, you know, everything that you're feeling on your body, neck, mid-back, low back, the whole thing.
Well, I'm always having like little headaches, migraines a month, and my neck, it always feels stiff from here, from the very first part of my neck.
Yeah.
And all my shoulders always, I feel them like tight all the time.
Okay.
My lower back, like I always feel like I need to be cracking my bones. I don't know why, but I feel like it's relief when I do a little bit, but instant relief, and then that's it.
Okay, so you did mention, so the headaches and the migraines are actually not little.
No.
All right, so how big are they?
Well, sometimes I cannot even see the light though.
Oh, okay.
Yes.
Yeah.
But I'm used to it. Sometimes that's why I said it's a little bit, because I'm used to them already. It's been too many years.
How many years actually in total?
I don't know, like 20, 22.
22 years.
I got used to them already.
Okay, so, but I think, I mean, a lot of this also dates back to, you had a surgery, I think you were how old?
7 years old.
Okay, so you had a surgery, you were 7 years old. They did some work on your jaw, right?
Yes.
But then then what happened?
They dislocated, and then after that, when I was a little bit older, I started chewing gum, and my head is starting really, really bad.
Yeah.
Like all this part here, my head, my neck, like I couldn't not even, like I was always looking like this, like watching it drive, like driving, walking, whatever.
Yeah.
It was really, really bad.
Okay. So, you know, with everything that's going on with you, I know you also had some low back pain from the pregnancy, but what are you ultimately trying to get out, like, of being over here?
Being over here, my neck and my shoulders.
Okay.
My lower back, I think, yeah, I need to work on that, but my neck, oh my God.
Okay, like what's one of your things, like, okay, if I could do this to you today, if I could help you with one thing, like what would it be about the neck?
I don't know how to say, mi cráneo, from over here.
The cranium, yeah? Okay, so that's gonna be the focus, right? And
yeah.
Like we saw in the x-rays there, you have lost your curvature in your neck. Ideally it's supposed to be 43, but it's really looking more towards like the 0 mark, okay? So that's what we're gonna recommend to you, the block that we told you about earlier, okay?
Yeah.
So let's first start off, first things first, is check your range of motion. Okay. Look to the left as far as you can. Is there any pain, tension, or tightness with that?
I feel a little bit tightness over here.
On the right side?
Yeah.
Okay, interesting. Now look to the right.
Too. A little bit over here.
A little bit on the left side? Now I want you to look up as high as you can. Does that hurt? Ooh, I kind of saw. Relax for now. So what happened there?
It kind of popped something here in the back.
Okay, and does that normally happen too? I mean,
yeah.
Okay. Now try to look down as far as you can.
I think that's it.
That's it? Okay, so if you've seen the videos, the goal is for your chin tuck all the way down. But that's as far as you can go.
Yeah. If I do it a little bit more, I think I want to try it,
but just don't, it's probably gonna hurt.
I feel really, really stiff over here, like all this.
Okay. Try to go down and touch your toes. All right. I think once we get to the bottom there, it starts to get tough on you, right? Any back pain, anything
here
on the right side?
Yeah, I feel like tightness, like
something's pulling you. Okay. So now keep the left leg completely straight, lift it up as high as you can. Okay. No pain, tension, any tightness?
a little bit here.
On the left side? Okay. Bring it down. Do the other one. That's a lot tougher, huh?
Yeah.
Okay. What do you feel with that one?
I feel like pain here. All this.
Okay. And I'm going to start you off first with the massage, okay?
Okay.
First comes the easy part, then gets the tough one. So, what does your day-to-day look like?
Well, I work most of them on the weekends, Thursday, Friday, and Saturdays. But during the week, well, I take my kids to school. I wake up really early. And then I tied up the house. I try to do exercise. I've been trying to do yoga a little bit more. But most of them I do running and walking most of the day. And then that's it.
Okay. Does any of this, like any of the stuff that's going on with your neck or your lower back, affect you when you're doing yoga, when you're trying to do some chores or anything like that?
The yoga, sometimes when you have to like bend a lot, that's when it hurts.
Like that child's pose, I think is what it's called.
Or when you do the child pose, and when you have to do like I don't remember the name, you have to be like standing, moving. That one with one hand,
It starts shaking.
Yes.
Okay. I mean, that could be just from like tiredness, of your arm there. But I mean, does it hurt your lower back? Does it hurt your neck?
It hurts my neck sometimes.
It hurts your neck too?
That's why I stopped doing it. Yeah.
Gotcha. All right. So what else? So I know you said you tried chiropractic. What else have you tried to do for the headaches, the migraines, and all that?
Essential oils, everything, because I don't want to take pills. It's the most natural things I can do.
Yeah. And that's why you're here.
Yeah.
Okay. That's the beauty of the videos too, is to I think that's what motivated you to come over here too. You want to get some relief, and just seeing what we saw in the X-rays. What do you think stood out to you the most?
My hip. I would never thought it was gonna be that bad.
And it's crazy. I mean, I know you're coming in with a lot of neck stuff, and you did mention some lower back stuff.
Yeah.
You had 2 pregnancies. Second pregnancy, the baby was pretty big. How big was he when he came out?
He was 9 pounds.
9 pounds.
9.
You're carrying around a 9-pound baby, and then plus the extra stuff that comes along with that.
Yeah, I felt so relieved when he was out.
Okay. So actually, back in high school, I took that class where they teach you about I think it's like home education, something like that. And I had to, I was actually one of the people who had to carry that 30 pound, well, it was a 30 pound belt that goes into here. 5 minutes, I needed to pee. I was like, how do you do this for about, it probably starts getting that big about the last 4 months, or last 3 months or so. So that's pretty intense.
Mine was like 4 months.
4 months of him being like that big?
Yeah.
Jeez. And so that actually got her hips tilting forward a whole bunch, which is what's giving her your lower back pain there. I think once we kind of get some more space in that area, the yoga should be easier to do as well. A lot of it contributes to the whole body, the mid back moving good, the lower back moving good, but I feel like nothing's really moving as it's supposed to. Yeah,
I always feel stiff. Even when I just feel relaxed, I still feel stiff.
I have to make you feel just all the way relaxed and staying that way for long term. Now, let's try this again. Look again to the left. Is that easier, same, or worse?
Easier.
Easier, right?
Yeah.
Look to the right.
Easier.
Yeah, okay. So this is a big component to your neck pain and everything going on because your ribs are actually all the way up here. Since you're a hairdresser, right?
Yeah.
How many hours do you think you spend doing all this?
5 or 6, sometimes more. I done 10 hours. 10 people at the same time.
Just back to back to back to back. Yeah, so all of that stuff, imagine the posture goes like this and your ribs are up here. The ribs start to elevate. And so when you're trying to turn your neck, it actually gets stuck because this is kind of blocking you this way. So my whole thing is to kind of bring that rib area down so you can try to turn your head, but also be able to do certain exercises as well. Yeah. Okay, so I'm gonna stand up on the table, okay?
Okay.
So we're gonna do this one over here. Here, I'm gonna bring your hair back a little bit. So she's been having the migraines and headaches for now, you said 20 years, 22 years?
Yeah.
It's a long time having to deal with the same issue over and over again.
Yeah.
My goal with you is trying to get things to move better and get in the right place so that way it's not that rough on you. I'm just feeling here, kind of seeing what needs to move, what doesn't need to move, because just because there's pain there doesn't mean everything has to move. All I want you to do is bring your head around this way, and I'm going to drop down here with you. And I want you to just kind of take a breath in through your tummy. There we go, and let it all the way out, and just kind of relax in there, okay? Bring your shoulder back there.
Oh my God. Ay, Dios mío. Oh my God, that feels so good. Thank you.
Yeah, just Let it settle.
Oh my God. Thank you. Oh my God, I feel so relieved. Like here, all this. I can take a nap.
I know.
Oh my God.
And this is just the first adjustment.
I can't wait for the rest.
I hope someone else can drive you home.
My mom. That's why I brought her.
That's good. So what did you feel with that first one right there now?
I felt so like less stress all this time. Like even my eye, I feel like open. I don't know how to explain it.
Yeah.
It's a weird feeling, but an awesome feeling.
Okay, I'm happy.
Yeah.
And that's just the first
Even
side.
my hands kind of tingling.
Yeah, because imagine with everything you had going on, did you ever get any numbness or tingling down your hands?
Sometimes. When I'm doing a lot, like 5 or more, I start feeling the tinglings.
Yeah, so that's not normal. That's not good.
Oh
So
my
now
God.
we're getting all that nerve flow back to where it's supposed to be.
Oh, it feels amazing.
You ready for the other
Yes.
side? Okay.
So ready.
Alrighty. So here, man, that's moving like nothing now. It's moving so easy.
I feel it.
Yeah. This one's gonna be a little bit different. I think we're actually gonna do it this way here. Bring your head this way. Let me just move this off to the side. It's like you watch my videos, you already drop your hand out to the side.
I watched them too many times.
Don't think about the videos.
Okay.
Alright, just let your body relax into here. Right there. The reason why we're doing this one like this is because we're trying to get everything to...
Oh!
Whew.
Oh my God. Padre Santo, qué rico.
Yeah.
Ay, gracias. Qué bueno que vine.
I'm glad you came as well.
Wow.
What's going through your mind after doing those 2 adjustments now?
I feel like I even want to cry.
Yeah, it's okay. I mean, has this whole journey been emotional for you?
I was nervous, but I feel so relaxed. I feel I can go on vacation right now. I feel good. Oh, wow.
So be honest with me, like, has there been days where you're just, the pain is so extreme where you cry or you get emotional?
Yeah, I do cry
Why?
because my neck hurts so bad.
Yeah.
But I feel so like I can move it without feeling like something's gonna crack or something that's not in the right position. I don't know. Even I feel like I don't know. I don't know how to explain it, but it feels amazing.
Yeah. And I think, just with doing this here, I mean, like you said, the main focus that you came in here was the migraines, the headaches, right? But if you had your neck curved like that forever, then it would never get better at all. Yeah. So I'm glad you came here, so obviously to get this all settled in there, okay?
I'm happy too.
I'm happy for you too. You ready for the next thing?
Yes.
Okay, so I feel like a lot of times, even with women, just in general, and hairdressers, they carry a lot of your stress right into this area. So I want you to just let everything rock back this way here, okay? Bring it back to the center and just relax in there. Good. Keep breathing in deep. Keep these elbows a little bit more together. Good. Just like that. Keep breathing in deep. All the way out. Just like that.
Oh, oh my God.
Wow. Okay.
Oh my God. Oh, thank you so much.
You're absolutely welcome.
Wow. Wow, wow, wow. Oh my God.
What are you feeling?
So much relief from everything, my shoulder, my back, everything. I have not even words to explain how relaxed and how good it feels.
That's good. When was the last time you think you felt nearly this good?
I don't even remember.
That's awful.
Oh my God. Oh my God. I can't believe I was nervous about this. It feels so good.
Yeah. And eventually you're gonna get addicted to this.
Yeah, I'm sure.
You doing good?
Yeah.
Okay. Now this arm, actually let me take this off for you. Okay. This arm's gonna go over you. Let's see, let's bring it around this way. Let me see the other one here, bring it there. So the goal with this one here, bring your head down a little bit more, is to get this bottom part here where it meets the lower back to actually come up. So that when you're doing yoga poses, when you're doing your workouts, it's a lot easier to get into that position, okay? So all I want you to do is just lay all the way back, all the way. Perfect, just like that. I know it's kind of weird and uncomfortable, but I want you to just kind of let everything kind of relax down there. Bring all the way down into my hand there. Perfect. There we go. I'm giving you little hugs in there just to kind of feel the tension in there, but keep breathing in deep. All the way out, just like that.
Oh,
there it is.
Whew. I felt it all the way here.
Yeah.
Oh my God. Wow. Wow, wow, wow. I feel like a new person already.
That's good. I feel like a lot of time, and correct me if I'm wrong, a lot of people come in here and they're like, I'm having all these pains. It's been going on for 15, 20 years, whatever. And it's like, I'm so young, but I feel so old.
Yes. I feel so old. I feel older than whatever I am.
Yeah.
But not right now. I feel amazing.
Okay. I feel like you're back in your teenage years again.
Yes. I can go climb the trees, jump the rope.
Okay.
Oh my God. Oh.
Yeah, just let it kind of settle in there, okay? I'm gonna put this paper on here. And even when you go home today, obviously we're not done yet. I want you to also kind of take a little walk with your body because you want to get your body adjusted to the adjustment. Okay, because it's gonna take you about a week for your body to fully register what I'm trying to do. So just gonna go for some walks, okay? Okay. Let's check it out here. I want you to bring the left leg up as high as you can. Okay, good. How's that feel?
I feel like a little bit stiffness, not that much.
Not that much?
Yeah.
Okay, yeah. Now do the right one. Okay.
I feel like I can move it even more.
Yes, you can. So that's actually really good. I'm happy. We haven't even touched the lower back. So this is gonna come around this way. Just hold it right there, okay? So we're gonna do a stretch for the lower back. So this goes around your ankles, here and here. And then you hold on to the handles there, okay? O mejor, esta aquí, más enfrente. Okay. Para que te dé un estiro más grande.
Ay, Dios.
No tan grande tampoco, okay?
I'm ready.
You're in for the ride. There we go. This is like a Superman ride. Okay. Do you feel the stretch in your lower back?
Yeah.
Good. So this is gonna also help pump the discs in between the bones so that we can kind of regain some of that like water in the disc, okay? Because that's the most important part to your height. I don't know if you want to be taller or shorter, but it'll make you a little bit taller.
That's great though.
How long have you been following the channel for now?
Like a year.
A year?
little bit more than a year, yeah.
Okay. What got you to finally say, I'm gonna make the booking now?
My neck. I was like, I can't be living like this. I want to feel how the people from the videos feel.
I agree, right? All right, now. Okay. Left leg is actually shorter, which is interesting because your right hip is the one that's actually the one that's off. So it's okay though. It's just a common thing that I see sometimes where the hips and the legs don't match together. So regardless of the fact, we're gonna adjust into the ankle here first. We're gonna get this to open. See, now that's looking better. And then esta aquí también. We're gonna get this one to open up. Okay. I'm gonna look at your x-rays like one more time, all right? Okay. So, we gotta focus on the hip placement now. You can stay there. Yeah, you're good. And then the table underneath you is gonna come up. Okay. So it's gonna scare you a little bit like this. I'm gonna make the tension a little bit easier. Ahí está. So you're gonna feel me in the hips and you're gonna feel me push into them like this.
Okay. Oh.
Yeah. Yeah. Bring the right one up again.
Oh.
Whoa! Okay. That's that's a huge difference. Good.
Oh, no.
All right. So the way her hips move on the left side are actually going forward. So the way we do this one is we kind of pull it back around.
Oh.
This way. Yeah.
It feels so good.
Man.
Yeah. Thank God I decided to come. Wow.
I mean, you're just gonna leave you here. You can take your nap, and then we'll come back in an hour.
I know, right?
How did that one feel?
Good.
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 Same deal. I want you to let the hip roll down towards me here. So she was born with a natural fusion of her L5 and the sacrum. So it's a different angle that we have to get it in because it's not in the normal angle that it usually is in. Bring this back a little bit more. Esto más para atrás. Así. Y déjalo aquí, ¿ve? Just leave that one there. I'm gonna bring this up a little bit here. Right there. No te vas a caer, okay?
Okay.
I got you right here. So. Just let your hip roll down with me here. All we're doing is bring this shoulder back.
Oh!
There we go.
Oh my God. Oh, qué rico.
To other chiropractors, but they weren't the same as this, were
No.
they? Okay.
No.
Lift your head up and then bring your head down. Okay, right there. So I know this is your first time doing this one here, so I'm gonna walk you through it. All I want you to do is keep breathing in deep and slow, like that. Yeah, good. Respira profundo, deep breath in, good. Perfect. And then put your hands onto your stomach just to let everything relax there. When you breathe in, push your stomach into your hands in there, and that's called belly breathing. Yeah.
Oh!
Lift up the head for a little bit there and bring it down, okay? I know that was a big movement you never had done before.
No.
What are you experiencing different about this one now?
I feel so relaxed, everything. I felt it all the way over here in the back, on the bottom.
That's crazy, which is good though.
Wow. I can't believe I was scared of that one. It was amazing.
So for anyone out there that, you know, it's scared like you too, like what would you tell them?
Don't be scared, just go. It's good. I feel like a new person.
That's good. And I think you really are a new person. I think when your body gets adjusted, you were so stuck to like a whole different person that you were, but now when you get adjusted and your body feels different, it can actually be who it is.
I feel more relaxed, way relaxed. Like even my shoulders, I don't feel them like always, I always feel them like up.
Yeah.
I feel them like they're relaxed. I feel them down. I don't even know how to explain it.
I think you explained it perfectly well. Yeah. It's like you feel like your guard's always there,
Yeah.
right? Trying to protect yourself, but now you can just drop your guard
Yes.
and just relax.
Yes.
All right. Nice. Lift the left one. Go.
Oh my God.
I think you can do.
Feel it even. Oh my God.
I think you can do a scorpion move now. Do the other one now. Beautiful.
Oh
Whoa.
my God.
Okay. Huge
Oh
difference
my
from what you came
God.
in.
Wow. Wow. Thank you so much.
Absolutely. My pleasure. Look to the left as far as you can. Do I need to say anything?
No.
Okay. Let's go to the other side.
Oh my God.
Look up.
Oh my God.
Way better. Look down.
Oh my God. I want to start crying.
It's okay. But yeah, it's an emotional thing, right?
Oh, yes.
What's going through your body?
I haven't even been able to move my neck like this in the longest time. I cannot even remember.
15, 20 years?
Probably. Oh my God. Thank you so much.
Absolutely. And now go down and touch your toes. Let's see that.
Oh my God.
How,
Wow.
how easy do you think yoga is going to be now?
Super easy. I don't even think I'm gonna feel stiff anymore.
Yeah.
Oh, wow. I'm gonna do it again because I can't believe it. Wow.
From 30 minutes ago when I first met you, and when we're doing all these checks, what do you feel different from your body now compared to earlier?
Like here,
Yeah?
my lower back and my neck feels so relaxed. I don't feel it stiff. My shoulders, I think my whole body feels way better. Oh my God.
That's good.
I'm so excited.
I'm excited for you too. And so, what I tell people too sometimes, when you're done with the session here, and it's really big. I don't know if I'm going to see you again because I know you're coming from a little ways. Just go for a walk, and even just maybe reflect on how your body feels today, because you're definitely not the same person you came in here with 30 minutes ago when I first saw you. You came in here to look kind of like so stiff, but now you're looking like you're actually relaxed and you have like an emotion to you. So I'm happy, and thank you for trusting me. Okay.
Thank you so much.
I appreciate you. Come here, give me a.
Thank you so much.
Absolutely.